Without further ado, I'm going to kick us off here. Good evening and welcome to the February 3rd, 2025 Grafton Board of Health meeting. As a preliminary matter, this is Jennifer Maynard, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dan Finn,
Dan Finn here.
Bill Mueller,
Bill Mueller here.
staff and anticipated speakers on the agenda. When I call your name, please respond in the affirmative. Nancy Connors,
Nancy Connors here.
Evan Brassard,
I'm here.
here. Molly Scannell,
Molly Scannell here.
you are. Devon Thornton,
Yvonne Thornton here.
Cherry Tangri, Cherry Tangri here. Great. And we do have some anticipated speakers on the agenda. When I call your name, please respond to the affirmative. Todd Kramer,
Here.
you. Shannon Felon, here. Thank you. I'd like to open the meeting. Can I get a motion to open the meeting?
This is Dan Finn. I'd like to make a motion to open this Board of Health of Grafton meeting.
This is Bill Mueller. I'll second that motion.
Favor?
Dan Finn, aye.
Bill Mueller, aye.
Jen Maynard, aye. Okay, this open meeting of the Grafton Board of Health is being conducted remotely, consistent with the Act extending criteria certain COVID-19 measures adopted during the state of emergency. This act includes an extension until March 31st, 2025 of the remote meeting provisions of former Governor Baker's March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which can be found posted on the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening's meeting. If the public has a question or comment on an agenda item, please utilize the Q&A feature in Zoom. Please include your full name and address when submitting a comment. For this meeting, Grafton Board of Health is convening by video conference via Zoom, as posted on the town's website identifying how the public may join. Please note that this meeting is being recorded and that all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and to take care not to screen share your computer. Anything that you broadcast may be captured by the recording. Any supporting materials that have been provided to members of the board of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Before we turn to the first item on the agenda, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I'll introduce any speakers on the agenda for a topic. After they conclude their remarks, I'll invite the board members to provide any comment, questions, or motions. Please identify yourself by name when speaking. Further, please remember to mute your phone or computer when you're not speaking. Please remember to speak clearly and in a way that helps generate accurate minutes. For any response, please wait until I yield the floor to you and state your name before speaking. If members wish to engage with other members, please do so through me, taking care to identify yourself. Finally, any votes and any motions made during this meeting will be conducted by roll call vote. Okay. Phew. One of these days that'll get shorter, I'm sure of it. Without further ado, we have put our agenda a little bit different this evening from our prior meetings so that our guests that have joined us can get their things out and you don't have to stay on. You're certainly welcome to stay on longer after that. But first, we'll hear from Todd Kramer from the Ambulance Committee to talk on a few topics. So, Todd, we'll yield the floor to you.
Hey, again, Todd Kramer. Thank you for having me. Can you hear me okay?
Yes.
Great. So, I'm the citizen member for the ambulance committee that oversees the contract for MedStar Ambulance, who provides the 911 ambulance service for our town. Um, I've also been tasked with writing the service zone plan for the state, which is the plan required by the state to describe how we provide emergency medical services. And that also includes anything that we do before the ambulance arrives. So that time period between when somebody has an incident and when the ambulance arrives. So in the process of doing the investigation and writing this plan, I found a lot of problems that I wanted to bring to your attention to see if you can help me resolve some of these issues. Um, let's see. In the process of taking care of somebody who has an incident at the municipal level, let's say they're in a municipal building or participating in a municipal event, we're supposed to have AEDs available and first aid kits. I did a pretty thorough survey of all these issues around town, and there are some holes that need to be filled. Mostly vendors not coming to actually inspect the AEDs. A lot of the AEDs are not on the walls properly. Don't have proper signage, and some of them don't have the proper pads. They both need pediatric and adult pads. Um, First aid kits is another issue. A lot of the departments don't have standardized first aid kits, and only one of them has Narcan in it. And everyone I talk to at all the different departments all really want Narcan and want Narcan training. And then some other departments need tourniquets. The police department keeps them on hand, but the school would like to have them available also. So there's no real standardized first aid kit, and so I just wanted to bring that up. Narcan's a big thing. Everybody really wants to be trained in Narcan, and then there's also the need for training in stop the bleed and having the appropriate equipment for stopping a traumatic bleed in a first aid kit. Some departments have already taken it upon themselves to use their own funds to pay for a vendor to standardize their first aid kit and monitor the AED, but that's only in one instance. So they're not well coordinated with the town hall, and they're doing it on their own. And then other departments don't know what to do at all, and they're really just lost. Um, but there's the state wants us to focus on the life-saving efforts at the town beach, and there's some problems there. So I've been working on trying to identify what those are. Um, ugh. So in this process, I noticed that training is an issue. AEDs, Narcan, stop the bleed. Um, And then the state also wants to know about what the Board of Health is doing at a community level to provide training for the community and employee staff um, to help with that time period between when somebody goes down and an ambulance arrives. So that would be CPR training, Narcan training, and that is pretty spotty across the board. Some departments are doing it on their own, others are not doing it, and some people are voluntarily doing it themselves privately. But there's no real effort at a town level to encourage all town employees to be involved. And again, this only involves town-based um, departments and town-owned buildings. It has nothing to do with non-town businesses. Um, Then, in the process of following the ambulance data that I'm provided by MedStar every month, I did a pretty deep dive into analyzing the last 3 years of data, and we're coming up with a lot of big issues that the town is experiencing that I was hoping that maybe you all would have some ideas about how to mitigate. Um, in the last 3 years, we had over 5,000 ambulance calls. In the last year, we've had an 8% increase in those ambulance calls from the previous year. Um, a good majority of these calls for 911 ambulances is due to falls and lift assists. That's pretty much our number one reason. And the second one is evaluations. And evaluations is pretty much a code word for psychiatric care. And combined together with falls and the psychiatric calls, around 40% of the time, the ambulance does not transport these patients. So they either assist the patient there at the scene and leave them be, or recommend another avenue to be able to access healthcare, or they don't need care and they've called 911 for a non-emergent reason. So this is holding up our ambulance service quite a bit. So I wanted to bring that to your attention and see if there's any programs at the public health level that we could help reduce these calls. There's a lot of addresses that use 911 on a regular basis. Um, just the high use addresses amount to about 10% of all the calls, which is pretty significant. Um, I've seen other towns um, have programs at the public health level to deal with fall prevention. They'll hand out stop socks to the at-risk population. They'll have the fire department go out and do fall evaluations to check for grab bars, step issues, ramps, anything to provide some better safety for preventing falls. I've seen other programs where they do community risk reduction and go out with public health nurses and actually talk to people, ask them why they're using 911 as their entry point into healthcare rather than using a PCP or social services. And amongst these programs, I've seen quite a bit of success in reducing 911 use by about 30% on average if it's a good aggressive program. So I was wondering if you all have any recommendations where to go with this. I'm bringing this all up because EMS is very expensive. The contract is very expensive. If we were to need a second ambulance in town, it will raise the price of the contract significantly. Um, I don't know if we'll be able to afford that. So I think we need to do something more at the public health level. That's pretty much all I have. Thank you for listening.
Thank you, Todd. Well, there's a lot there to unpack. Certainly, I think in our collaboration, just to start, in our collaboration as being part of the Alliance, some of the activities that you've spoken about in certain locations, we may be doing some of these things, but we could perhaps look at the addresses with you all and do some more targeted outreach. That said, we have a couple of clinicians that are also on the Board of Health, as well as our, again, affiliation with the Alliance. And I'm going to open it up to questions by the rest of the board, but this sounds like it's a big enough issue and something that we can make a deeper impact on if we create a small short-term subcommittee to sort of put together some standardized expectations for things like the kits, a regular training schedule that we could do some of the things that Alliance, again, is doing with us that maybe we just need to open up more broadly. And then again, some new targeted interventions to the falls prevention piece, I think is a big thing that a lot of communities are struggling with, especially with older adults in particular, and not knowing sort of where to refer them. And of course, we have a great council on aging who also helps to connect people, but they may not already even be connected there. So just to start, and I'd love feedback from Bill and Dan, if you all think a subcommittee with some of us, as well as some members of the Alliance, would be valuable, of course, with Todd being at the table for that.
And if I may, this is Dan. Todd, you came to our last opioid subcommittee, or AKA Grafton Opioid Recovery Community Partnership meeting, and that was good. And I'm quite sure we're going to be able to supply the amount needed of Narcan pretty much for free. There are 2 or 3 sources that are coming up, and it's a matter of just putting that into place and finding out where we're going to put them. But my other question is, have you spoken with Marianne DeFries from the Greater Grafton Medical Reserve Corps in your travels?
Oh, yeah, yep, I have.
Okay. Because she has offered through that outfit, which I happen to belong to, trainings in Stop the Bleed and falls and various things. But I don't know that they have been open to all municipal staff. I think primarily for volunteers that have committed membership or whatever to the MRC, but maybe that could be expanded to get some folks more training, you know.
Yeah, similarly, they might have, Dan, I'm also on there as well. They might also have some resources for us to put together around, standardized expectations for kits and things like that. If not, I'm sure we can kind of survey what people are doing and then kind of make an easy checklist. Um, Bill, what are your thoughts on creating like a small subcommittee for this work? I know you're both on a subcommittee already, so you don't have to volunteer for it.
Well, there's some overlap with the
Yes.
opioid committee, and certainly, as Dan has alluded to, the Narcan part of it, I think, may be a relatively simple part of this. As far as having, standardization of first aid kits, proper maintenance of automatic defibrillators, things of that sort. I think that probably does require a little bit more multidisciplinary sort of thought.
Yeah.
But I think if you have a group of people who are frequent flyers, that are apparently using the 911 response mechanism inappropriately, certainly there must be a way of trying to at least educate those people in terms of how best to do that. I'm not sure what it is, but I'm sure there are some resources that might be useful in that regard.
Yeah, and it might even be something us creating for, again, a resource, one-page resource list or something like that for the first responders to give to people or something like that as a first step. So I don't know if we want to make a motion on this to create a subcommittee, and I'll say I'm more than happy to join this subcommittee since I know Dan and Bill are already doing one. Definitely some overlap, but I'm happy to help on this one. Go ahead, Dan.
I think we should wait just a little bit, another month or so, until Todd gets closer to completing his survey and see what the real scope is of it. Not that we don't want to do it, and I'd like to get everyone's opinion on it. I'm pretty sure, and again, Todd, is there a specific vendor right now for the first aid kits? Just
No, everybody's pretty much cobbling together their own first aid kits.
Yeah.
Um,
out of their
the-
individual department budgets, I guess, right?
yeah, and so like the police department, they have their own specific vendor that actually helps them with the AEDs and first aid kits and trauma
Yeah.
kits, but the library has nothing. The public works department, they have created their own vendor system and their own first aid kit by Cintas, who comes in and does all the reviews and refills any first aid kit issues. Town hall, senior center, they have no real coordinated effort. And the town beach has no coordinated effort at all. They're pretty much using their own funds to refill whatever they use up.
Go ahead, Evan.
And the school system is a completely different system. They're a little bit more organized. Actually, they're a lot more organized. They keep track of everything. They keep track of their AEDs when they need to be checked, when the pads are expiring. They keep track of their Narcan, and then pretty much they're on par with what needs to be done.
The municipal center has Cintas as well, as far
Okay.
as for AEDs. All AEDs are maintained on a monthly basis. And we have 3 in the building. We added another one in the fall. So we have one upstairs, one downstairs, and one in the senior center. We only have one first aid kit on the municipal side, and that's one that we purchased separately through a vendor. And I believe the senior center has their own purchase, so we could look to standardize some of that um, pretty easily. We just haven't had the need like highway and police go through a lot of supplies, so they have Cintas come in and replenish their supplies. Um, we've had our go bag for a first aid kit in the municipal center for 2 years without opening it. So it's just a matter of different needs, but we'd be happy to hear any standardized recommendations that come out of your group.
Of course, things expire as well, so they should be, looking for those things as well as, it might be a good opportunity to help some of these different locations. Not everybody has medical staff. So setting them up for success, like, who's your key point of contact at the building, who's making sure that, Syntax or whoever it is comes in and actually looks. Otherwise, very easy, of course, for things to sort of slip through the cracks and things to get missed. I'm going to say Dan and then
Yeah, Jenna, is the chat disabled? I think Anne Marie had something to say, but are you able to get her on the phone?
see. Hang on 1 second. It shouldn't be disabled. I don't see anything now, but I can allow her to talk. Hang on 1 second. Ann Foley, that is.
Anyway, she just mentioned that she'd be happy to help with the falls prevention program. She has some expertise there. And again, I think it's a very worthwhile thing to get it together, but I'd like to get Karen's opinion and see how interdisciplinary we want to get with the committee, just keep it sort of workable,
Yeah.
you know, a couple of different departments involved and stuff.
Great.
Maybe we could get back and revisit it next meeting. Is that all right? As a suggestion.
Todd, when do you think your survey of sort of all the possible parties will be completed?
Be completed as soon as I'm done with this meeting, because I just wanted to hear what you all had to say, and then if there was anything I needed to add to the plan.
Yeah.
So,
Yeah, I mean, it sounds like something that, we should participate in and just kind of helping get organized and utilizing, again, the great resource we have in the Alliance, as well as just consistency. And then, of course, sorry, Nancy, but Nancy has, all sorts of applications that she processes. So, if this is sort of, safety and public health related things, there might be something on if people are getting licensed or things like that and checked on. It, might be something that we want them to sort of say, yeah, we've had our recent training and things. I mean, that's really kind of down the road, but we can have some levers to sort of make sure we have checks and balances in place for this moving forward. Molly, thank you.
great.
Patience. Go ahead.
Yeah, I was just gonna say that I'm sure Amelia has a lot of resources for this. I just wanted to chime in on the Alliance side of things that I've taken notes, Todd, and I'll see what we can do on our end, and then I'm sure we can help in any way possible.
Great.
This is kind of like Amelia's specialty, so I'll relate things to her and then we'll collaborate.
All right. So we'll bring Karen up to speed. I'm happy to be one of the participants from the Board of Health. We'll definitely want the Alliance. Todd, Evan, we might tap into you for some things as well in case there's financing needs across the scope, of course.
Absolutely.
And then maybe Nancy, do you want to maybe connect with Todd offline and just maybe get some dates for maybe March, later in March or mid-March?
Okay.
That could work for potential meetings, and we could do virtual if that's easier for folks. All right.
I'm open to either way.
Thanks for bringing all of this to our attention. I think it's really, one, obviously, we want to make sure that the town isn't having to get an additional ambulance unless it's truly needed. And it's, I think really important for better outcomes for everybody in the community.
Agree. Thank you.
Right. Thanks, Todd.
Thank you.
All right. Shannon, thanks for your patience. Welcome.
Thank
You're
you.
able to share your screen and you're going to talk about restricting the use of second generation anticoagulant rodenticides in Grafton.
Yes. Thank you for having me. Again, my name is Shannon Phelan, and I'm a Grafton resident. I'm also a volunteer for Mass Audubon's Rescue Raptors campaign. So the purpose of my speaking tonight is just to give you a little bit of background on the issue. You probably have heard of these campaigns before, and lots of different actions going on at local and state levels. And I just wanted to give you, just kind of keep you in the loop on what our campaign is working on, and also learn about your perspectives on restricting these types of rodenticides in town. I'm also going to be asking the select board next month to think about creating a policy to restrict rodenticides, certain types, on town-owned land. So what I'm speaking about tonight really just applies more to town land and not private property. But later on down the line, we may be submitting a petition, a home rule petition, to be able to regulate pesticides on private property. But for now, it's just town property. So I will share this. Okay, can you see this? Good?
Yes.
Okay, so the types of rodenticides that I'm referring to are commonly referred to as SGARs, or second generation anticoagulant rodenticides, with these 4 specific ingredients. They are typically in the black bait boxes around structures. You see them everywhere. The way that they work is that they prevent blood clotting in rodents. And they're supposed to be used only by professional applicators, so licensed pest management companies. And the reason why they're an issue is that there's documented impacts to wildlife and pets from secondary poisoning. I won't get into that here because I know that your focus is on human health and people. One statistic I found is that there were over 8,000 reported ingestions by people in 2022. More than half of those were children under 6. So it is a documented issue, and many Massachusetts towns have already banned these types of rodenticides on municipal properties. There's a list here of the ones that have already, and then there's more than 50 others that are in process right now. Even Boston, that has severe rat infestations, has phased out the SGARs. So the solutions would be integrated pest management, which I'm sure you're very familiar with, heavily focused on sanitation and human behavior. The first step is exclusion from buildings, sealing up holes, removing debris piles and logs and vegetation against buildings. And then the next step is to starve them, removing the food sources like open dumpsters and trash, bird seed accumulation, open compost bins. And then lastly, the last step is to target and kill the rodents. And there's old school technology that works and a lot of new technology that has come out. So as part of their study last year, the city of Boston did a Boston Rodent Action Plan report. And I thought this quote was particularly important. They said, Boston property owners and renters seem to believe that the rat poison baits placed around property and area perimeters will compensate and or substitute for good trash practices. Sound science research, however, has shown this practice without the elimination of the rat's food sources to be essentially 100% ineffective. So what that's saying is, if you're not cleaning up and taking care of your trash and removing the food sources, there's no point in putting out these bait boxes, as effective as they may be. So you probably want to know, what are the alternatives to SGARs? There's always the good old snap traps that a lot of pest management companies who are focusing on poison-free marketing to their clients, that's what they swear by. And also predators. And one owl eats approximately 1,000 rodents per year. So we're essentially, with the secondary poisoning to wildlife, we're killing predators that are supposed to be controlling these populations. There are many new technologies on the market. There are electronic traps. Some of them are simple, like just a zap. Some of them are more complex with computerized monitoring. The Victor V-Link mouse tunnel trap. There's also fertility control is a new thing that municipalities are trying to break the breeding cycle of rodents. And then for burrows, they have things like carbon dioxide and dry ice, and even there's even glow in the dark bait to make the feces glow in the dark to be able to track where they're entering structures. And then there are other bait options that aren't anticoagulant. Vitamin D3, the commonly sold as Decon, is an option. It's still toxic, but it's not. It doesn't bioaccumulate, and it would just be primary poisoning, but not secondary. And then corn gluten meal is another. Our campaign does not recommend the use of bromethalin, which is not one of the 4 ingredients in an eschar. It's a neurotoxin, but it does bioaccumulate. And even our Tufts Wildlife Center here in Grafton just did a study on that, how it is also impacting other animals. So we don't recommend bromethalin. So for your involvement with a restriction on eschars on municipal property, at least I don't anticipate much change, but that's why I would like to ask you about that. And of course, human health is always the priority. And if there were an extreme infestation, such as that could affect children or any people really, there would be an exemption to use eschars for short term as a last line of defense. But what we want to try to avoid is just throwing out the bait boxes as a preventative measure, just because we don't want to clean up our dumpster or something outside of a commercial building. And then for private property, if these rodenticides do get banned on private property, this would be in the future, the Board of Health would likely be involved by doing some outreach and education, maybe having some information on their website, promoting sanitation, maybe doing spot checks or inspections. So that's really all I had to say. There is a meeting on February 26th. It's a kickoff meeting for the campaign if you'd like to attend that. I have a lot of resources. If you need, links or contact information for other towns that have done this successfully, I'm happy to provide that. So again, feel free to contact me and I'm happy to help. But otherwise, I can try to answer any questions that you might have.
Thank you, Shannon. First, would you be able to send your slides to Nancy so she could post them for folks that might want to look at them?
Yes.
Here? That'd be great. I mean, obviously they can watch the video, but sometimes people like to look at slides. I did, apologies if you mentioned that, and that you probably maybe talk a little bit more with the select board on this, but has there been, is there data on sort of the cost differential between sort of existing treatments that might be used versus transitioning to some of the newer ones?
So I know like one of those electronic monitoring boxes, those are about just not buying in bulk quantities or with any discounts or anything. Those are about $100. How many you would need, I wouldn't be able to speak to that. But in terms of other cost comparisons, that information I could try to get from the campaign and share with you. I don't have it off the top of my head, but I do know that pest control companies that are focusing more on exclusion and identifying the sources. They are not significantly more expensive than a company that would say come out on a contract and put the bait boxes down. So it's fairly similar for that.
Great, thank you. Bill, Dan, any other questions for Shannon? And then obviously, Evan, if you have comments, questions. Go ahead, Dan.
Yeah, I think it sounds great, and it'd be good to take it to the Board of Selectmen, but in my opinion, that's a good plan. And I don't think you necessarily have to wait too long to get it out to the general public too, just in terms of education. Yeah.
Yeah, absolutely.
Okay, great. Thank you.
Bill, anything?
Well, have pest control companies that service these towns complied with their restrictions?
Oh, yes, of course. Some of these towns, like I know Arlington did this 10 years ago. Some of them are more recent, but it would be up to, I guess it would be up to the town administrator or whoever executes the contracts to just communicate to them that they're not able to use those types of pesticides anymore. Again, except if it was an extreme infestation, and that would be probably up to your group to decide.
So it would be something they were familiar with. And
Oh,
would
yes, the
comply
pest control.
with, yeah.
Yes.
Evan, any questions, thoughts?
No, generally, so I met with Shannon and Anne Marie, and we talked through kind of this proposal or project, and generally speaking, we are on board with that. We do have to, dot a couple of I's as far as lining up companies and making sure that our contracts are in order. But I mean, it seems like a definitely a good direction for us to head in. So I don't think you're gonna hear any pushback from the town. So
Interested, I think, in conservation in town as well. And we've got great birds of prey around with our river behind us. So
Yeah, absolutely.
that's great. It sounds like we have a great uh, natural kind of environment to adopt some of these things as well. Great. Well, Shannon, thank you so much for joining us. And as I mentioned, if you could, you have Nancy's contact information.
Yes.
Yeah, send her over those slides. We'll be happy to get those posted so we can, again, get it out to the broader group if folks are interested in doing it in their own homes as well for pest control.
Great. Thank you so much.
Thanks, Shannon. Take care.
Good night.
Great. Our Alliance friends, thank you for your patience this evening and learning all sorts of new things going on here in Grafton. Would you like to kick it, Molly? Would you like to kick us off at the Alliance updates tonight?
Sure. I'm disappointed Shannon just left because I wanted to tell her that I saw a bald eagle today in the middle of Worcester in Maine South.
Ooh.
Yeah, I know, it was very surprising, but
We
that
have
was
a
cool.
we have a lot of those in Grafton.
I know,
We're
I
very
know.
spoiled, and we have owls too.
For me, it was really
I'm
cool.
sure. That's cool.
Um, okay, so for COVID and respiratory illness updates, COVID numbers are increasing. At the moment, we had 20 cases in Grafton for January, which is an increase from the 11 we had in December. The BioBot analysis wastewater summary reflects this current rise in results, which is again expected for this time of year. Bear with me, I'm getting over a cold, just so you know.
Is this season?
It is. We had no reported cases of pertussis for January or December. So this is the second month with no reported cases of pertussis, which is again good news for our schools. For the 2025 respiratory season, prevention practices include masking, hand hygiene, and vaccinations according to your provider's recommendations. Getting the 2024-2025 COVID vaccine is important because the vaccine's efficacy decreases over time, and the updated COVID vaccine protects against the currently circulating strains. During the week of January 19th through January 25th, 18.6% of emergency department visits were for acute respiratory diseases. This is in local hospitals, including COVID, RSV, and flu. Oh, I'm sorry, that was national hospitals. In local hospitals, we have seen an increase in flu A this year versus flu B, flu B has historically been more common this time of year. So this year it's flu A, which is a little surprising. Masking, hand hygiene, vaccinations, and staying home when ill are still the recommendations for preventing and managing respiratory illnesses like flu A and flu B. And the state sent out an advisory today, actually. Nancy got it this morning or this afternoon about increasing cases of flu and this was sent out for informational purposes and for public posting. Other updates, the DA presentations for seniors at the Grafton Senior Center is April 25th at 10:30 a.m. And the first topics will be scams targeting seniors. We have our vaccine clinic scheduled for February 25th at 12 p.m. to 2 p.m. in the Municipal Center gym. And we will be offering shingles, RSV, COVID vaccines, specifically Pfizer this time, and the pneumococcal vaccine, specifically Prevnar 20. There's a few of them out on the market, but we'll be carrying the Prevnar 21. This is the follow-up clinic to the one we had on September 27th. And those people that got their first round of shingles vaccine will have the opportunity to get the booster on the 25th. And I'll be calling those people who signed up, who got the first vaccine. So I'll be calling them to sign up for the second clinic if they haven't gotten the booster yet. Oh, and the flyer is in the works right now. So we'll get that to you, Nancy, as soon as possible. Blood pressure clinics continue every other week at the Grafton Senior Center. I saw 15 patients at the clinic held on January 2nd and 13 seen on the 16th. And I snuck in an extra clinic in the month of January because there are 3 Thursdays in January instead of just 2. And I saw 11 that day because people weren't really expecting me. Kind of a slow time of year too, but we get them when they come in. Topic of the month for February is neurovirus, and that is submitted for posting. For national updates, I've spoken about bird flu and neurovirus before, but it's worth mentioning again because it's kind of a big deal now. The H5N1 avian flu strain, also known as bird flu, is widespread in wild birds and domestic poultry worldwide. In the US, bird flu is causing outbreaks in poultry and dairy cows, with 67 human cases and 1 death so far. At this time, there are no reported cases in the whole state of Massachusetts, which is good news. All commercial food service workers and farm workers must wear protective PPE, and the CDC and World Health Organization are looking into what is considered appropriate for these instances and their effectiveness. Currently, the public health risk is low, but an important precaution is to be careful around dairy cows, wild birds, and poultry, and avoid consuming unpasteurized or raw milk and undercooked poultry. Infected birds can shed avian influenza A virus in their saliva, nasal secretions, and fecal matter, and flocks become infected when they have contact with each other with other infected birds. They also can become infected through contact with surfaces that are contaminated with the virus from infected birds. This outbreak has led to a limited supply of available eggs for purchase in grocery stores nationwide. And I've seen that there's like limited egg supply. You can only buy so many cartons of eggs at a time if you could find them. I think it's getting a little better. Neurovirus cases are currently on the rise. It is a leading cause of foodborne illness in the US right now, causing over 58% of foodborne illness cases. It is also currently the leading cause of gastroenteritis, which is inflammation of the stomach and intestines due to the symptomatic vomiting and diarrhea associated with neurovirus. Each year, the virus causes over 900 deaths in the US and over 100,000 hospitalizations. The vomiting and diarrhea, which is the most prevalent symptom, can lead to dehydration, which is a particular concern for the young and the elderly. Bed rest and fluids are recommended in recovering from a norovirus infection, but there's no pharmaceutical intervention to prevent or shorten the infection time. Outbreaks are common where there's direct contact with infected individuals or contaminated surfaces. The virus is very transmissible and can be transmitted even after a person is fully recovered, in some cases up to 2 weeks. Precautions include hand washing before eating and after using the bathroom, not consuming perishable foods that have been sitting out for more than 2 hours, keeping raw meat separate from other foods, washing all fruits and vegetables well, not drinking raw milk, cooking all meats well, and not eating raw meat at all. Make sure what is being cooked reaches the recommended temperatures. And the interesting thing is hand sanitizer is not effective against norovirus. Only bleach-based solutions and good hand washing or friction hand washing, it's called, with soap and water can kill the virus. We have seen many facility outbreaks of norovirus in Worcester and the other Alliance towns, but none in Grafton this month. No. Good. Kansas health officials have reported a tuberculosis outbreak in the northeast part of the state with, again, 67 active cases since January 2024. That's a year from January, making this one of the largest outbreaks in U.S. history. Officials have reported dozens of active cases in Wyandotte and Johnson counties. Tuberculosis, also known as TB, is caused by a bacteria called Mycobacterium tuberculosis, and it is spread through air from one person to another when a person with active disease of the lungs or throat coughs, speaks, or sings, with germs more likely to spread in indoor areas and places with poor circulation, such as a closed vehicle. The germs can stay in the air for several hours. And for those who become infected, symptoms include a cough lasting 3 weeks, chest pain, weakness, fatigue, sometimes blood in the sputum. When people have the TB bacteria in their bodies but have no symptoms, it's called inactive or latent TB, and they cannot spread it easily to others. But without treatment, people with latent TB can develop active disease and become sick over time. Kansas officials state the risk to the public is low at the moment, and so far neighboring states such as Missouri and Texas have not seen any outbreaks or an increase of cases at this time. So the risk is low, but any questions? I know that was a lot.
All the bugs possible circulating.
Yeah, I know.
Any questions for Molly? Jace, that's enough, Mo. Let's see. Opioid settlement funds? Who's up for that? Terry, Dan, Evan? Not Evan, sorry, Bill.
I have, yeah, I can speak to that. But before that, I have a few updates,
Great.
if that's okay. Okay.
Of course.
So, the Central Mass Regional Public Health Alliance, in collaboration with Grafton, the town of Grafton is holding an open house on February 27th from 12 p.m. to 2 p.m. This event at the time is open for all Grafton municipal employees. So what we are hoping is that we can have a one-on-one conversation with, the employees coming to meet us. We will have posters and a presentation running on, and we can have one-on-one dialogue on and a discussion on what are some of the initiatives that are going on in the town of Grafton, as well as what we do as a public health alliance and a public health department. In the previous years, we had seen that people did not know much about the alliance. So uh, this was an initiative started by our previous director. And we have done one so far in Shrewsbury, and it was successful. So we are hoping to do that in Grafton and our other towns as well. Um, uh, on January 23rd, the division hosted the launch of Hope Model, which falls under the MassCall 3B grant. It was an implementation. It was basically the launch of the implementation stage for the grant after going through various stages, the assessment, capacity building, etc. So this model stands for healthy outcomes for positive experiences, positive childhood experiences, and is a strength-based approach that is to support the families and children by focusing only on the positive aspects of their experiences. So this is basically a holistic approach to practice the positive childhood experiences. And the rationale is that it helps the brain heal from trauma and allow build resilience. Just for those who do not know what the MassCall grant is, it is the grant through the state that uh, uh, is, that aims to delay the first use of substances such as alcohol, tobacco, and marijuana among the youth. The other upcoming, not an event, but something for the boards to know that in the coming months, our tobacco coordinator, Kyle, he would be coming to present, do some presentation of the existing tobacco regulations for all the board members so that he can have a conversation about, how he does the inspections, and if the boards have any questions around that, he can answer that as well. And then for the opioid settlement, Nancy and Mary were successfully able to complete the Narcan application. So now they were waiting on just getting trained so that they are able to have Narcan through the boards of health. And we could have it at any event or, for whatever use within the municipality. And I think we had few members from Spectrum. Dan, correct me if I'm wrong. Were they from Spectrum, Matt?
Oh, yeah, no, it's actually a 501c3 company called GAP,
GAP,
GAAP.
Okay. Yeah.
Right,
So-
Matt Gear and John
Yeah.
Mahefkin. They're going to come to our next meeting with a presentation and perhaps a request or an application for a mini grant. And I believe the woman who works closely or is involved with District Attorney Early's office's drug task force is going to come as well.
Okay.
And they certainly seem legit and they do a lot of good things. And we had a particularly short meeting. And those guys, by the way, happen to run a healing safe house in South Grafton with 16 individuals, clients. But anyway, it was a short meeting because of time constraints. And I just wanted to mention that I think everybody probably read in Nancy's synopsis of her annual report that Mary and the Alliance are, along with, put together a nice piece about how the Grafton Opioid Subcommittee, so to speak, came to being and what we're charged with. And I just happen to think they hit all the bases on that. If you haven't read it, you should probably check it out.
Yeah, and then I also wanted to share that Matt Gear and his colleague were also talking about that they knew an organization in Rhode Island and were going to touch base with them to provide some, the transparent dispensing boxes, some information around that, because the group was interested in having those placed uh, at within in the municipal buildings. So that is something that they will bring with them the next time they come in. Yeah, that's all I have.
Anything to add? Or are you good? Bill, you're good? Nothing to add? Good. Okay.
Well said.
All right. Devon. Always save the fun stuff for the last part of the Alliance update, right?
Nothing fun has happened lately. Good evening, everyone. So since January 6th, we've done 10 comprehensive food inspections. We've had one complaint. The complaint started out as a complaint about an overflowing dumpster. When I inspected, the issue was more that the complainant was just upset that the business was leaving the dumpster open throughout the night, so it was allowing wildlife to get into the dumpster and ruffle things up. So I spoke with management. That issue is going to be taken care of. We've had 2 Title V inspection report reviews, 5 septic plan reviews, and 2 well plan reviews. So far, things have been pretty smooth. I think it's because of the cold weather. Things will pick up when it gets warmer.
Yes.
That's all I have to reporting, unless there's some questions.
Yeah, after we made it through, what is it, day 362, they say, of January or something? It's a very long month, cold month. Yes, thank you, Devon. Any questions for Devon from the members of the board? Great.
Well, Molly, I have a question.
Go ahead.
Can bird flu be transmitted from animal to human?
It can be, yeah. So
Oh.
that's how we're seeing it mostly.
Okay.
So far, it hasn't been transmitted from human to human. It's animals every time.
Okay.
So that's why people in like commercial food industry have to wear the PPE. And unfortunately, this is kind of yucky news, but people have been infected when they go to eradicate flocks. That's how they're getting infected. People are becoming sick that way by being around the infected birds. So it's always animal to human at this point. And we're hoping it stays that way instead of human to human. It hasn't
So-
happened yet.
Even wild birds.
Even wild birds,
Okay,
yeah, but
okay.
mostly it's poultry just because humans come in contact with domestic birds way more often. But I don't know the numbers of wild birds to domestic birds, but we hear mostly about the poultry industry.
Well, okay.
Great, thank you. Nancy had sent around to the board our full updated fee schedule. That was a labor of love. Nancy, are you all set with that? Anything for us to talk about here beyond that? That's all updated. Are you talking? I can't hear you, Nancy. No? Nancy, can you hear me? Yeah, she can hear me. I can't hear her. It was working earlier. You can text me or drop it in the chat if you have anything for the fees. And we had her on both points. Let's see. Oh my gosh, hard to believe. She wants us to talk about July through December meeting schedule. Let's see. I'm gonna hold on that. Let's see. We had a few meeting minutes here from October 7th and then January 6th. So let's start with October 7th. Were folks able to review the October 7th minutes and want to make any motions?
Yeah, this is Dan Finn. I'd like to make a motion to accept the minutes of the Grafton Board of Health from October 7th, 2024 as presented.
This is Bill Muller. I second that.
Dan Finn, I.
Bill Muller, aye.
Jen Maynard, aye. And the minutes from January 6th, 2025.
I read them, but I didn't attend that meeting, so technically I don't know if I can.
You can.
Okay.
You can.
Well, then-
Yeah.
Then this is Dan Finn, I'd like to make a motion to accept the minutes of the Grafton Board of Health of January 6, 2005.
25.
This is Bill Muller. I second that.
Roll call.
Dan Finn, I.
Bill Muller, aye.
Jen Maynard, aye. That might be a little before my grafted time, Dan. Okay, I'm gonna hold off on the meetings from July to December just till we have Karen back. It's always helpful to all kind of go through and make sure we're planning on being around for those dates. And then old new business, we wanted to, I think, get started about the annual rabies clinic. I think you usually try and schedule each fall, Dan. Any updates on that?
Yeah, I think Nancy may know more than I on that. Have you been in touch with them, Nancy? No, okay. I'm gonna call Nancy tomorrow and we'll
Okay.
get that together.
Yeah. Anyway, usually try and do the dog licensing and the free rabies clinic for Grafton residents
Right.
in the fall. So yeah, we probably should start reaching out to them a little early. Okay. So then we have our, oh my gosh, March is scheduled to be our last remote meeting. Right now, I don't think we've received anything that there's going to be an extension of the remote meeting provisions. Certainly, I'm sure Nancy will share with us if we get any modifications. But if not, we should all plan to be seeing each other in the conference rooms as indicated on the schedule, which is April 7th, conference room A, May 5th, conference room F, and June 2nd, conference room A. And then, as I said, next meeting, when the four of us are anticipated to be here, we will align on some dates for July through December. Dan.
I have one last question. I'm trying to ask Nancy, but since she doesn't seem to be able to respond, Evan might be able to help. Just wondering if we have in fact posted the position for another member of the Board of Health and where we post that. That's just the Grafton News, or does it go on the website or both?
Yeah, as far as I know, it's been posted. It's on the website per our general process.
Yeah.
So it just continues to get turned over. So
Yeah.
And we'd be happy certainly to, if you get multiple people that apply, we'd be happy to work with the select board to meet with anybody in anticipation of that.
excellent.
Great. Anything else, members of the board or others?
Nope.
Mr. Finn.
Good, Ron.
I have one more complaint. Nancy reminded me that I needed to report. We had a complaint. I think it was earlier this month. It was a complaint about an establishment. A customer walked into the establishment and there was a dog. This was a food establishment. There was a dog on the table. So I went to the establishment to speak to the owner, and it turned out that it was the owner's father and his father's dog. So we spoke to him about that.
Yes, I believe that came by way of social media. So thank you for following up on that and just double clicking with the establishment that, pets are not permitted on tables or in their establishment. We appreciate that, as I'm sure the consumers do as well. All right. Mr. Finn.
This is Dan Finn. I'd like to make a motion to adjourn this meeting and remind everyone not to forget their Valentine's.
Very good.
This is Bill Muller. I'll second that motion.
Roll call.
Dan Finn, I.
Bill Muller, aye.
Jen Maynard, aye. Thank you, everyone. Great content and much to talk about in the coming months.